My PICO question is, in veterinary patients, is the hashtag method of scrubbing the skin more effective than the concentric circles at reducing bacteria levels on the skin? In this presentation, I will be comparing two surgical skin preparations to see which one is more effective at reducing the levels of bacteria on the patient's skin. The two methods I will be comparing are the hashtag method and the concentric circles method. Unfortunately, there is little to no research advising us which method of application for antiseptic solutions to use. However, there are some key points that each method must meet in order for it to benefit the patient. The patient's skin must be clean before starting the skin prep, so we do this by kind of clipping the fur and hoovering away the fur. Starting along the incision line before moving outwards in concentric circles or starting the back and forth method. Allowing the solution to air dry, ensuring the solution doesn't pool under the patient. This is important to make sure the dirty water or dirty solution isn't able to find its way back onto the surgical site. So one of the surgical skin prep options is the hashtag method. The hashtag method is a surgical skin prep that consists of going over the skin in a back and forth motion many times for however long it takes for the full contact time. This does require quite a bit of kind of movement going back and forth over the surgical site, but definitely starting at the surgical site for a minimum of 15 seconds. Recent research and discussions have discussed the back and forth motion to be the ideal surgical skin prep. However, there is a severe lack in evidence for this technique. However, the antiseptic agent will reach deeper skin layers where the most of the microbes are found. Back and forth friction methods, as said above, rubbing the skin with a sponge is necessary to remove the bacteria, and the antiseptic solution can penetrate into deeper layers of the dermis where the resistant microorganisms are found. The other method I would like to talk about is the concentric circles method. This method consists of starting on the surgical site for a minimum of 15 seconds and working our way to the surgical edges in circles, discarding the swab when you reach the edge. Repeating this until the swab comes off clean and the patient has had the correct contact time for the concentration used. Now, this method is probably what everybody has been taught, and it definitely ticks all the antiseptic boxes because we're not introducing new bacteria to the skin. However, the antiseptic solution doesn't reach the deepest skin layers where the microbes are found, as there is very little friction against the skin other than at the surgical site. Now, antiseptic solutions are a big part of surgical skin prep. The method and the technique won't necessarily matter unless you have the antiseptic solution up to certain standards. There are many antiseptic solutions available in the UK, however the two main agents are chlorhexidine gluconate and povidone iodine. Both of these can be made with the alcoholic solution or the aqueous solution. Now, factors that the ideal antiseptic solution should meet include being active against a wide range of gram-positive and negative bacteria, viruses and fungi. The solution must be fast-acting, have a residual effect, to continue to be active even with organic material such as blood or dirt on the skin, and most importantly to be non-irritant or toxic. Chlorhexidine gluconate, also known as Hibby scrub, can kill a range of gram-positive negative bacteria, viruses, fungi, and binds to the top layer of the skin, therefore having a residual effect throughout the procedure's length. Povidone iodine can also kill a range of gram-positive and negative bacteria, viruses, and fungi. It is slow releasing, so it can kill bacteria quite quickly, but it doesn't contain a residual effect. It can be inactivated by organic materials, so is only effective on clean skin. Alcohol. Alcohol can kill a range of gram-positive and negative bacteria and many viruses and fungi. It can kill faster than chlorhexidine and povidone iodine, but it does have a very minimal residual effect. Alcohol is proven to be a powerful antiseptic when chlorhexidine is added into the mixture and is considered to be the agent providing the majority of the antiseptic properties, with the benefits of chlorhexidine such as the residual effect. Alcohol should always be used in the dilutant state, so added with water, as denaturing proteins doesn't easily occur in the presence of water, therefore it's not denaturing the chlorhexidine. Many practices really struggle to know the correct contact time as well as the correct dilution ratio, therefore affecting the level of bacteria on the skin. To find the correct dilution, read the manufacturer's instructions. Contact time may differ depending on the dilution ratio recommended or even used. There are lots of different concentrations of chlorhexidine or povidone iodine, so checking the manufacturer's instructions for that specific product is important. When using when unsure of contact time, the general rule is to leave the solution for 5 minutes. However, povidone iodine is known to need longer. Cleaning materials. It is advised to use non-linting swabs, as the linting version is known to leave particles on the surgical site, therefore contaminating the patient. Non-woven swabs are thought to be a better choice than the traditional woven swabs, as they are gentler on the skin. Cotton wool is also another option, but it shouldn't be used especially during the final scrub, as there are many fibres and it can contaminate the surgical site. Paint pad style applicators are claimed to provide the most appropriate amount of friction, gently rubbing the skin to help the antiseptic solution penetrate the first 5 layers of the skin. Although these applicators are designed to help perform gold standard protocols and procedures, they can be expensive, and some registered veterinary nurses may want to stick to what they've been taught. Especially, it's a bit intimidating with these new things coming on the market when they haven't had that much research behind them. But these are known to perform gold standard and to deliver the correct amount of friction and rubbing, and they contain the correct percent of disinfectant. Evaluating the hashtag method. So, as you can see here, it's good at removing dirt. It's effective as an initial scrub because it definitely removes dirt and will reach deep into the skin layers where microbes are found. It leaves the surgical site sterile and it's safe for staff to use. However, unfortunately, it does risk introducing new bacteria from the edge as we are going back and forth, potentially bringing bacteria back into the surgical site. It's not as known, so it might not be performed to the best standard, or it might not have even been taught correctly. So that's definitely something to think about. Evaluation of the concentric circle method. So, a positive will be that it will not bring bacteria back into the surgical site because we are removing the swab once we get to the edge of the surgical site. It would make a good final prep once you've moved into theatre in case you've touched the surgical site when moving in. It's very well known. Most nurses use it probably daily, if not multiple times a day. It's very easy to do and it's safe for staff to use. Now, unfortunately, it doesn't reach the deep layers of the skin, therefore, it's not going to achieve the best antisepsis. We might be able to consider a combination of both, starting with the hashtag method as the initial scrub to remove as much dirt as possible and to penetrate deeper into those layers of the skin, and then consider the concentric circles method just to finish it off in theatre. In conclusion, when doing both of these methods on their own, they are achieving average standards, but when used together, they have the potential to achieve the best form of sterility. Using the hashtag method as the initial scrub, removing the dirt um, and reaching really deep into those skin layers, followed by the concentric circle method as a final scrub after moving into theatre.